True life medicine is for those who are looking for something different. And different is going to mean different things for different people. So the common people that find us are those who are seeking actively for something different because they're dissatisfied with what I would call is the typical American healthcare response to their question. Whether that question is, hey, I want to feel better, or hey, I'm sick, I have a major disease. True life medicine is also for those who want something more, and innately they understand that the healthcare system in its typical way offers you mostly a pill. If you want to have a better marriage, if you want to perform better at work, if you want a better sex life, if you want to be able to play soccer with your 16-year-old kid instead of just watching soccer, you will not find any of those in a pill. My vision for true life medicine for people is driven by them. So the focus is on the person or the patient. Where do you want to go? What is your vision for your true life? At True Life Medicine, we typically deal with things like young moms who they are busy, they are wives, they are now mothers of 2 or 3 kids under 3, and they find themselves in a place they've never found themselves, fatigued. This is not them. I just don't feel right. And again, in the typical American medical response, they are given a medication, and it might be an antidepressant, or they might be referred to a counselor, all of which is good, but it doesn't address the underlying issue. Or a 50-year-old man who thought of himself as well, he is told then by his doctor he needs to lose 10 pounds, and his blood pressure's high, and his cholesterol is now borderline. He thought he was doing pretty good, and he was offered a medication to treat these things. He understands that this isn't going to help his marriage or help him run faster or help his knees not hurt quite so much. Those things aren't found in a pill. If we speak to that 50-year-old guy, that does reduce his risk of heart attack or stroke over the next 20 or 30 years. So every day for the rest of his life, he will take this pharmaceutical medication and have less chance of heart attack or stroke. But he won't find within that medication increased vitality, increased vigor, increased zest for life. He will not find an increased enjoyment in his work or in his hobbies. What I want to partner with people on is, number one, finding out what is their marriage and their work and their hobby, what drives them, what do they define as true life, and then, okay, how can we partner together to increase the chances, not that you won't have a heart attack or stroke, I mean, of course, that goes without saying, but to increase the chance that you do better in your hobbies, that you increase your accuracy of your jump shot or your archery hit of the elk, or how fast you can quilt. Well, and we say that facetiously, but women in aching hands. And if they love quilting, they will lose that. And they will get told, well, gosh, I'm sorry you have arthritis. The first thing we do is give you Tylenol, then ibuprofen, and then we give you some meloxicam, and then on and on and on the pharmaceutical response goes, and you are putting thicker and thicker Band-Aids on that symptom. And that's okay if that is your choice, but many people want something more.